If you're looking to pay less for your Medicare Advantage plan, whether that's lowering your monthly premium, reducing your copays and coinsurance, picking the right plan, this is the right spot for you. In today's video, we'll talk about ways to reduce your Medicare Advantage monthly premium, also how to pick the right plan, how to avoid some of those costly mistakes, qualifying for special programs, things like D-SNPs and C-SNPs, and of course, the Medicare Part B payback. So by the end of this video, you'll know how to spend less, save more, and choose smarter. Stay tuned. So first and foremost, what exactly are Medicare Advantage plans? Now, if you're already familiar, you can feel free to check out those video chapters in the description below and jump ahead. Medicare Advantage is an alternative to Original Medicare. It's offered by private carriers and must offer at least the same benefits as Original Medicare. However, many plans choose to offer additional benefits to entice beneficiaries. Most commonly, these are things like dental, vision, hearing, and prescription drug. And even though these plans may offer these additional benefits, very often they do so at a very low or possibly no additional cost. So what is the catch? Well, as I said, Medicare Advantage plans are offered by private carriers, and as such, you are beholden to their networks. Now, these can be HMOs, which will offer you less flexibility, or PPOs, which will offer you more flexibility, but still not as much flexibility as Original Medicare alone. And some people do report difficulty in finding doctors or even hospitals that accept their Medicare Advantage plans, especially when we're talking about specialists. There's also the issue of pre-authorization with Medicare Advantage plans. That means that between you and the procedure or service that your doctor has recommended stands your insurance company. They must first pre-approve that specific service or treatment. This can lead to delays, denials, and certainly a big headache when it comes to submitting additional paperwork. So those are the basics. Now, very commonly, Medicare Advantage plans are confused with Medicare supplement plans, but they really are very different. And I've got a video that goes more in depth I will put at the end of today's video if you'd like to learn more. But if you are set on a Medicare Advantage plan, let's talk about how you can pay less for it. So first, let's talk about that $0 monthly premium that many Medicare Advantage plans boast. Now, it's very important to remember that yes, although many Medicare Advantage plans do offer a $0 monthly premium, they are not free. Many insurance companies receive a fixed monthly payment from Medicare to manage your care. Because of that, they can set the premium at zero and still make money. This is because Medicare is paying them to take on your medical risk. So as you'll see when we check out Medicare.gov in a few minutes, very often there are quite a few $0 monthly premium plans to choose from. And obviously, this is a great way to save money. But remember, you'll still need to pay for your Medicare Part B unless you choose a plan that has that Medicare Part B giveback, which we will talk about later in the video. However, not all Medicare Advantage plans are created equally, and it's very important that you still choose the right plan for your needs. Because if you choose a $0 monthly premium plan, but none of your doctors are in network, none of your benefits are covered, you're still going to end up paying quite a bit more. So how do you know if a $0 monthly premium plan is right for you? Now, this is not always the case, but very often those less expensive plans do tend to have less benefits or maybe more restrictive networks. So a $0 premium plan is great if you're healthy, or you have routine medical needs, you rarely see specialists, and of course if you want those lower monthly bills. However, a $0 premium plan might not be a good fit if you see several specialists, you need expensive imaging or frequent treatments, you have chronic health conditions, your prescriptions are costly, or the plan has a high out-of-pocket max. And yes, Medicare Advantage plans will have an out-of-pocket maximum. This is actually one of the great things about Medicare Advantage plans, because Original Medicare does not have an out-of-pocket maximum. That means that should you have major medical needs, there is no yearly cap on your spending. Medicare Advantage plans will impose an out-of-pocket maximum. However, if you have a $0 monthly premium plan with a very, very high out-of-pocket maximum, you may end up spending quite a bit more than you would if you were to choose a plan with perhaps a more reasonable, although still low monthly premium and a much lower out-of-pocket maximum. While we're talking about premiums, let's talk about that Medicare Part B giveback, sometimes referred to as a rebate or a buyback. The Part B giveback benefit is a plan benefit where insurance companies pay part of your Part B premium for you. In 2026, the standard Medicare Part B premium will be $202.90 per month. Of course, it can be more based on your income. It could be $30, $50, $100, or possibly even the whole thing. However, that's pretty rare, and if you've found such a plan, let us know in the comments below. Now, depending upon the plan, the giveback will show up as a reduction in your monthly Part B from Social Security, or a credit on your Medicare bill if you pay directly. You must be enrolled in Part A and Part B, live in the planned service area, not be on Medicaid, and not be in a D-SNP. Now remember, these plans aren't available in all areas, and they're not ideal for all people. Just like we talked about with those $0 monthly premium plans, you still have to make sure that the plan fits your needs. So very often, if a plan is offering you a buyback, they're making up those costs in another way. So if you're someone with more extensive medical needs, then this might not be the type of plan for you, based, of course, upon your specific needs and the terms of your plan. However, if you're someone who's in pretty good health, just looking to save money on bills, then this could be a great way to do so. Let's check out Medicare.gov really quickly so I can show you some of those $0 monthly premium plans, as well as that Part B buyback. So here we are on Medicare.gov. We're going to scroll down to where it says Find Health and Drug Plans, and I'm going to put in a Florida zip code because Florida tends to have a lot of Medicare Advantage plans to choose from. We're going to click Medicare Advantage, also known as Medicare Part C, Find Plans. We're going to put that we don't get help with our Medicare drug costs from any of these programs. And ordinarily, I would highly recommend that you put in your prescription drugs that you know you take. That way you can really adequately compare plans. But for the purposes of this video, we're just looking to see some of those $0 monthly premium plans as well as the giveback plans. So we're going to say no, just in the interest of time. We're also not going to put in our providers just in the interest of time. But if you were actually looking for a Medicare Advantage plan, you would want to put in your provider to make sure that they accept your plan. So here we go. 10 of 50 Medicare Advantage plans. Now, right now it is sorting by lowest drug plus premium cost. Because we didn't put in any prescription drugs, it's really just sorting by premium cost. Already we can see $0, $0, $0, $0, and so on and so forth. So that's where you will see your monthly premium, if it is a $0 monthly premium plan or not. So far, those first couple of plans are all $0 monthly premium plan. This doesn't include the standard Part B premium. However, I will say I noticed this. Let's scroll up. Where did I see this? Devoted Giveback. So I'm going to guess that this plan is one of the giveback plans based on the name alone. But there is a way, of course, that we can find out. Part B premium reduction. If you just click over here under plan benefits, if there's a check mark next to the Part B premium reduction, then you can determine whether your plan offers that Part B premium reduction or not. But the question is, how much? Well, let's look at the plan details. So if you scroll down here, standard Part B monthly premium, $202.90. This offers a reduction of $184.70. So really, that's almost the entirety of the monthly premium. Again, this is not the only thing that you want to look at. You need to make sure that the plan still serves your needs. Otherwise, you will end up spending more for it in the long run. Now, unfortunately, I don't know of a way where you can just filter by the Part B givebacks, those reductions. If you look here, view all filters, it doesn't offer that as one of the filters. So you will probably just have to go through and click see more benefits. See, this one doesn't offer the Part B premium reduction. See more benefits, doesn't offer the Part B premium reduction. To determine if your plan does offer it, although like I said, in this case, they made it very easy because it's in the name of the plan itself. So you will likely, but this one doesn't, this just says Humana Gold Plus. It doesn't specifically call out in the title that it offers that premium reduction, and it's not something that's over here. So you do have to click over here where it says Plan Benefits to determine if this is offered by the plan that you're interested in.
Now let's talk about D-SNPs. D-SNPs are dual eligibility special needs plans. These plans are designed for individuals who are eligible not only for Medicare, but Medicaid as well. And if you are someone who's eligible for a D-SNP, this can be a great way to save money. D-SNPs often include $0 premiums, $0 copays for most services.
And when services, treatments, and medications are not offered at no cost, they are certainly much, much lower when compared to traditional Medicare Advantage plans.
Remember, they will offer the full benefits of Medicaid plus Medicare. So if you are someone who's eligible for Medicaid and Medicare, we highly encourage you to take a look at one of these types of plans. But these are not the only type of special needs plans. There are also C-SNPs, which are chronic illness special needs plans. These types of plans are specifically tailored to individuals who've been diagnosed with a list of a specific series of chronic conditions. For example, diabetes, chronic heart conditions, COPD, kidney conditions, heart disease, and more. You can find a full list on Medicare.gov. These types of plans are great because they may lower specialist costs, lower drug costs, offer better coverage for condition-related medications, offer disease-specific coordination of care, offer extra transportation or nutrition benefits, and offer predictable out-of-pocket costs. So if you are someone who qualifies, again, we highly encourage you to take a more critical look at these types of plans because they could be a great way to save money as well. One of the most crucial ways to save money on a Medicare Advantage plan is simply to pick the right plan for your needs. An HMO may be great if it offers you a lower monthly premium. However, if none of your doctors are in network, you're going to end up spending a lot more. If your plan offers dental coverage, that may be excellent. However, if it's not the dental coverage that you need, again, you could end up spending quite a bit more. So please make sure that you choose a plan that is more tailored to your needs. There's a series of questions that you should ask yourself. First, who are my providers? Make a list of all of your providers. Even missing one doctor can cost you hundreds of dollars by forcing you out of network. Also, list every prescription, not just the expensive ones. A $0 premium plan can turn into a $700 medication bill overnight if a drug isn't covered. Review the out-of-pocket max. We talked about this earlier in the video, but this is your worst case scenario. Lower is usually better unless those premiums are just much, much more expensive. Also, look at the hospital network. A plan may look perfect, but if your hospital isn't in network, you're taking a massive financial risk. And compare those fringe benefits last. Many Medicare Advantage plans do offer additional benefits, such as dental, vision, hearing, over-the-counter medications, fitness, meals, and transportation. These are great, but they're really not the main focus when choosing a Medicare Advantage plan. Also, don't chase that $0 monthly premium unless it fits your usage. Now this is all well and good, but the truth of the matter is choosing a Medicare Advantage plan is extremely difficult. That's because Medicare Advantage plans can vary widely. Not only can the costs vary widely, but the benefits as well. So if you do need assistance, we highly recommend working with a broker. A broker is a third-party liaison who works for you, not the insurance carrier, and they can help you choose between a variety of different plans offered by different carriers at no additional charge. If you'd like our assistance or you have any questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers and we're licensed nationwide. And as I said, there is absolutely no charge for our services. Now we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date. And of course, please make sure to like this video so we can get this information out there. All right, let's get back to it. I also want to talk briefly about some of the most common mistakes that you can avoid when choosing a Medicare Advantage plan. First, don't choose a plan based on the dental benefits. It's great that many Medicare Advantage plans offer dental as an added benefit. However, very often that dental just isn't adequate coverage. Now, it may surprise you to learn that many private dental premiums are actually much, much less expensive than you might otherwise think. They certainly don't compare to health insurance. And choosing a private plan will enable you to choose a plan with a much, much higher out-of-pocket limit, or rather a plan limit. And of course, choose a plan with a wider network and plans with lower copays or more benefits covered. So please, I do encourage you to take a look at those private dental insurances as well, not just rely on your Medicare Advantage for your dental coverage. Choosing a $0 plan without checking copays is also a big mistake. And we've touched upon this a few times, so I promise not to talk at length about it, but your monthly premium is not the only cost you need to take into consideration. You also need to look at your deductible, copays and coinsurance, and your out-of-pocket maximum. You also need to look at the benefits that are offered and the network to determine if the plan is right for your needs. Also, make sure to check the plan's prescription formulary. This is huge, confusing, and commonly overlooked. So if your plan offers prescription drugs, and we highly encourage you to enroll in a plan that does, then you need to determine what the costs of your medications would be on that plan. You can do so by checking out the plan's formulary. Your medications will be divided into tiers. Generally speaking, the higher the tier, the higher the cost. You also need to look into if there's a separate deductible or out-of-pocket maximum for your medications as well. Make sure that you're choosing a plan with low prescription drug costs because in addition to your basic medical coverage, this is one of the most important benefits. And finally, make sure to review your plan every year during the AEP. For Medicare Advantage plans and Part D plans as well, the AEP or annual enrollment period is every year from October 15th to December 7th. During this time, it's very important that you review your plan to determine if it's still the best plan for your needs. Your benefits may have changed, costs may have changed, your needs may have changed, or there may be new plans available that are better suited to your needs. So make sure you take advantage to make sure that you're always enrolled in the best possible plan for you. If you need our assistance, you can reach us in the comments below or at the number on the screen. As I mentioned, we are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. I'm also going to put that video that I mentioned earlier comparing Medicare Advantage to Medigap plans, as well as our All About Medicare playlist. And before you go, please make sure to like and subscribe. We'll see you next time.